My name is Merima Sestovic. I'm one of the infection preventionists working at Stanford Health. My job really is to prevent the spread of infections, so to our employees, to our visitors, and to our patients. So the best way to prevent the spread of infection is the basic 101 hand hygiene. So I'm going to show you how to wash your hands with soap and water because that's very effective for most of our organisms. So here we go. First thing we do, we're going to open the water. It's a nice lukewarm temperature is just fine. Make sure you get a nice, after you wet your hands, nice gulp of soap. Would cover your hands completely. CDC recommendations are that we wash our hands with the friction for about 20 seconds. So you can do ABCs, Yankee Doodle song. Make sure you cover all surfaces. So starting with your thumbs, that we cover all the surface from top and back hand. Then we go between the fingers. We do our wrists as well. And also not to forget our fingertips, because underneath the nails there's a lot of organisms that can harbor. So we're going to do both and kind of twist a little around on in the middle of your palm. And then we do that for 20 seconds. And then we're going to do the rinse. And it's the friction and the running water that will remove the germs off of your hands. Normally the soap does not kill germs, but it is this action of 20 seconds of rubbing and rinsing that will really remove the oil, the dirt, and the organisms. And then once you're done, you're going to grab a paper towel and you're going to pad dry your hands. You want to make sure that you don't do a lot of friction with the paper towel, because that also can make your hands drier, and we don't want to make hands drier because we don't want any cracks in your hands. Then after you pad dried your hands, then you're going to close off the faucet with a paper towel so you don't recontaminate your hands. I'm going to show you now how to sanitize your hands. So first thing, you want to make sure that your hands are not visibly soiled. If they're visibly soiled, then you need to go and wash with soap and water. But if they're not visibly soiled, then we're going to use a hand sanitizer. So we're going to take a nice, good amount of sanitizer. It needs to be a good amount to cover all the surfaces of your hand, including your wrists. So we're going to start rubbing in the middle, on the palms, and then between the fingers. Then we're going to go to the top of the hand, and then we're going to between the fingers up top, and then we're going to do the other hand between the fingers. Don't forget to do your thumbs, and then the wrists, and then we're going to do the nails, because nails harbor a lot of organisms, right in the middle, and same thing with the other hand. Okay, and then we're going to make sure that we air dry the hands. Don't blow in your hands, because we don't want the germs from your mouth come to your hands after you just nicely sanitize them. We're just going to let them air dry. Your hands should be wet for at least 10 to 20 seconds. There is an emollient in a sanitizer, so your hands are actually more protected than if you're using soap and water with too much friction with a paper towel.